Welcome to Benita's Maternity Program webinar. Today we'll be speaking with Dominique LeClercq, who will be explaining to us everything we need to know about your pelvic floor. Hi, Dominique.
All right, so what you can expect to learn from today's webinar. So I'll be going into what is the pelvic floor, signs to pick up when you have an issue, common complaints or causes of a weak pelvic floor, the effect of pregnancy on your pelvic floor, how to perform these pelvic floor exercises, a few tips to preventing common complaints, and also just correct toileting postures. So let's start off with what is the pelvic floor. So your pelvic floor, this is a band of muscles that form a hammock in your pelvis. The floor of the pelvis is made up of layers of muscle and other tissue. These muscles also then help support your pelvic organs, which include your uterus, your bladder, and your bowels. The pelvic floor muscles also help stabilize your spine. So included in the pelvic floor are sphincters. So these are essentially muscles that surround your urethra and your anus. These are exceptionally important when you want to stop yourself from peeing, pooing, or passing wind when you don't want to. There are signs that might indicate when you have an issue with your pelvic floor. So these signs can be if you are leaking urine or if you have a feeling of vaginal heaviness. These are the two most common signs. Less common signs can be any sort of pain in your pelvic girdle, lower back pain, constipation, and even pain during sexual intercourse. So what can a weak pelvic floor lead to? So there are many issues that can occur if you have a damaged or weak pelvic floor. This can be urinary or fecal incontinence. So this is essentially just involuntary leaking of either urine or feces. You can experience urgency and frequency, so constantly needing to go to the toilet, but then only a little bit of pee comes out at a time, as well as pelvic organ prolapse. So this is when the pelvic organs bulge either from the front, the top, or the back into the vaginal wall. There are other common causes of a weak pelvic floor. So these causes can be menopause, straining on a toilet, constipation, having a persistent cough, any form of pelvic surgery or radiation for cancer, heavy lifting of objects, high impact exercise, age, and weight. So it's not only about a weak pelvic floor. You can also have a tight pelvic floor. Remember that tight does not necessarily mean strong. It means the opposite exactly. So a tight pelvic floor, this refers to shortened muscles that are stiff, and this can contribute to pelvic girdle pain and pain with sexual intercourse. They can also put pressure on your bladder neck, which leads to more urinary symptoms, such as having an urgency or frequency of wanting to go to the toilet. Can also cause your bladder and your bowels to not empty properly. And although it may be less common, it can still be extremely distressing and cause a lot of pain. So why should I be doing my pelvic floor exercises? There are so many benefits to having a healthy and an optimal functioning pelvic floor. So starting with the exercises before you fall pregnant or even during your pregnancy can decrease any damage that may occur or the added strain of carrying a growing baby. This also helps with decreasing the risk of injury during vaginal birth, and it also speeds up your recovery afterwards. A strong pelvic floor can also make sex more enjoyable and pleasurable for both partners, not just the one. So it also helps women postpartum to return to exercise and recreational activities faster, and it just gives a good support to your pelvic floor and your pelvic organs. It also increases social confidence and your quality of life, and it just helps prevent future pelvic floor dysfunctions. So what actually happens to the pelvic floor during pregnancy and birth? So as your baby develops and grows in your uterus, there are some changes that happen to the floor as well. Your pelvic floor muscles, they need to work harder than normal during pregnancy because they have to support the weight of your growing baby or babies, and they are softened by the effect of your pregnancy hormones. So during birth, if you have a cesarean or a vaginal birth, they both affect your pelvic floor muscles. So if you look at your vaginal birth, they undergo a considerable amount of stretching and strain. So this is when the baby actually passes through the vaginal canal. And then during a C-section, this is when the surgery that actually goes through multiple layers of your abdominals. And your abdominals and your pelvic floor are actually very closely linked. So dysfunction to the one side can influence the other side. This often leads to a slower recovery generally and just a weakened abdominal wall. So it's best to speak to a physiotherapist that's trained in pelvic floor dysfunction just to help adapt an individual exercise program during your pregnancy or after. And these exercises, as your pregnancy progresses, they do become a bit more challenging. So it's good to have a graded and a progressive program. So what happens to your pelvic floor after you give birth? So your body overall has undergone quite a number of changes, and it may take some time before you return back to before your pregnancy. There are quite a few things that we as physiotherapists need to consider when we look at returning you to exercise after you've had your birth. So we need to consider the state of your perineum. So this is basically just the area between the anus and the vulva. So that's just sort of the undercarriage. And if you, and the second length of second stage of labor. So this is when the baby moves down through the vagina and is born. So that's normally the quicker part on labor. In the first 6 weeks, we focus more on letting the pelvic floor recover before we start with the exact strengthening program. However, when you feel ready, we start suggesting that we gradually ease into it. So strengthening, we say from about 6 weeks postpartum, and then we also look at things as if you have any tears, or if there's any perineal trauma, or if you had a episiotomy, where they actually make a surgical cut to prevent further tearing. So we also need to get that part to recover before we just start with all our exercises. So when you're seeking help, this is very important that you are assessed correctly, that if you notice if there's any problem with your bladder or your bowels, there are many other reasons other than just a weak pelvic floor that can be causing your issue. So we just want to be thorough and be 100% sure we know exactly the cause of your exact issue. So first place to start when you notice that you've got an issue is to discuss the problem with your gynecologist. Your doctor will assess you and do some investigations. And then once cleared from your doctor and we have identified the problem, based on your result, your doctor will recommend either pelvic floor physiotherapy to further help with your pain or your urinary or your bowel symptoms. So it's good first to go back to gynecologist just to clear if there's any other big problems. So how to do a pelvic floor contraction? So first, we actually need to locate the correct muscle. So we do this by using 2 different techniques. Both techniques are either in sitting or lying down. We often find that if you try it in standing, because of gravity, it is a lot more difficult. So the first technique, we want our moms or any woman for that matter, to sit or lie down with their thigh and buttocks muscles relaxed. So you can either bend both legs up, you can have your legs lying down, it doesn't really matter. We want you then to imagine squeezing the ring of muscles around your anus, so that's at the back passage, almost as if you are trying to pass wind or if you want to stop wind from passing. Now we want you to then relax the muscle and then squeeze again and let go a couple of times. So we don't actually want the buttocks to squeeze, and that's too much. We just want that anus, so it's almost a little sphincter that we were talking about earlier, to contract and relax. So it's not only about contracting, we want you also to learn how to relax without sort of straining or pushing. There should be no pushing involved here. So that is just the back passage contraction. Now our second technique, this is for the front, so at the vagina. Again, to sit or lie down. And I want you to imagine the feeling of stopping the flow of urine if you're on the toilet. We don't want you to do this while you're actually urinating. This is just really not good for bladder mechanics and also just teaching bad habits. We want you just to imagine that feeling. It should be sort of a squeeze and a lift. And then we want you to imagine relaxing. So again, we want you to squeeze and lift and relax. So the relaxing is just as important. If you've practiced this a few times, both sides, if you don't feel a distinct squeeze and lift of your pelvic floor muscles when you try and do the squeeze, then this is when a pelvic floor physiotherapist can come in and we can actually do a manual evaluation to see if the correct muscles are being recruited. So it's very important that you get it right or do it correctly. So now if you can feel the squeeze, we want you to aim to hold it for 5 seconds, 6 seconds, 7 seconds, 8 seconds. Start with trying to hold it for 5 seconds. That's sort of a good starting point. Then once you've practiced, choose the amount of seconds that you can hold the squeeze before the contraction fails. So for some women, it will be 5 seconds. For other women, it'll be 10 seconds. Once you're practicing just getting the contraction and timing yourself, you'll soon get a feel of what you are capable of and just dial it down a bit. So you're going to repeat this squeeze and lift as many times as you can, although as a guideline would like to aim for about 8 to 12 squeezes. Remember, the squeezes are held for at least 5 seconds or building up depending on your ability. And then we like to say about 3 sets of your 8 to 12 squeezes. So try link these exercises with an activity that you commonly do in your day. This will just help keep you motivated and serve as a good reminder so that you don't forget to do them. So getting it right. It really is not as easy as it sounds. It does take practice, so it'll be good to try it on your own at first in a quiet room when there's not too many people around you, where you can actually lie on your back. I find if you started in lying, it's definitely a lot easier, and then you can progress to sitting. A lot of common mistakes women make is holding their breath. So throughout all of these contractions, a deep breath in through the nose and out through the mouth, and then squeezing other muscles. I often find that my patients tend to want to squeeze the bums together. The bums have nothing to do with it. Even the shoulders, we see the shoulders moving, we see the legs being squeezed down. Nothing else should move. It's quite a quiet exercise, so we shouldn't actually be noticing that you're doing something. Another thing that women tend to do that is incorrect is bearing down. This is more a pushing or straining feeling. So instead of just gradually letting the contraction go, they tend to push the pelvic organs down, which actually can be quite detrimental and make it worse. So that we call that bearing down. All right, so what can you expect if you go to a physiotherapy consult for your pelvis? So we do a complete subjective history taking of your complaint. That is everything from your bowels, your bladder, sexual in-depth functioning. We look at your birthing history. We look at multiple factors. So it is quite a long consult in the beginning, and we're going to ask quite a few questions. We also perform an internal gynecological exam. So this is the best way for us to assess your pelvic floor muscles internally. We look at the strength, endurance, coordination, the length of the muscle to see that it's not shortened or that it's not lengthened. There's a lot of things we can look at. And then based on our findings, we will then give you an individual tailored program and then also some other exercises. So it's not just about the squeezing and lifting. It's a lot to do with breathing exercises, gluteal, so buttock strengthening exercises. There's a lot we can do, but usually it's a lot of the pelvic floor exercises and a lot of breathing exercises. We find there's a big correlation between the two. All right, we get this a lot, the I don't have time excuse. I use it too. So as a woman myself, I completely understand that we have a lot on our plates, and now there's also a newborn added into the mix. So the good news about your pelvic floor muscle exercises is that no one will ever know that you are doing them, and they're the perfect secret exercises that you can do whenever you want. You don't need a gym setup, you don't need a mat, you can do them from whatever position you are in. So instead of making these pelvic floor exercises a chore, rather incorporate them into your new adapted routine. So the easiest way to remember to do them is to use activities to remind you to do them, or just set a reminder on your phone. That might also be the easiest. We often say stick to the less is more concept. So instead of doing a lot all at once, rather break it down to doing less repetitions, but just more frequently in the day. So activities like when you are breastfeeding or you are breast pumping, these are the perfect opportunities to cure your exercise time, because you might be sitting for at least 20 minutes and uninterrupted. So the most important thing about these exercises is that it's all about you and it's all for you. So it's about putting your overall well-being first. So the health of your pelvic floor, this is going to play a big role in your life. So you can prevent common pelvic floor dysfunctions before you even notice any symptoms, or if you already have symptoms. You can drastically reduce them or cure them, and this also leads to more pleasurable sexual intercourse and orgasm. So it's never too late or too early to learn how to do them. Basically, all women should be doing them, not just pregnant women, postpartum women. All women should be doing this at some point in their lives. So here are just a few tips that you can use to prevent or reduce pelvic floor dysfunction complaints. So you can start with a healthy diet with an adequate amount of fiber and adequate hydration. So if you are unsure or if you need guidance on nutrition, I recommend speaking to a dietitian. She can guide you for during your pregnancy or after, or as I said, any stage in your life. It's good to maintain a healthy weight. Women with an increased body mass, it tends to put a lot more pressure on the pelvic floor and a lot more pushing down or straining. So if you have a healthier weight, you have less pressure on your pelvic floor. I also recommend using a small step to support your feet when you go to the toilet, but I'll discuss this in detail on the next slide. Don't rush when going to the toilet, and then also just regular exercise, low impact, and then also just regular relaxation and breathing exercises, just so that you aren't too stressed or worked up. Next, this is our correct toileting posture. So I recommend sitting upright on the toilet. We like to use a small step that supports your feet. So this essentially just gets your hip to be at an angle less than 90 degrees. So about 35 degrees, if you look at the picture at the bottom on the right, you can see how your position changes. So we'd recommend doing deep breathing exercises. Don't strain or force the bowel movement or push hard. Should be a very calm experience. And then don't rush, because rushing often leads to straining. So if you look at the picture on your left, there is a picture of the rectum and it's sort of a little band that goes round the anal canal. So that little band, that is a muscle called puborectalis. And what happens is when you are sitting without a foot support, your hips are 90 degrees and it ends up actually choking the rectum. So if you try have a bowel movement in that position, you have to push quite hard against a muscle that's already got quite a bit of tension. But if you lift your feet with a little chair and your feet are relaxed and your hips then move upright, that little muscle, that little sling tends to relax around the anal canal, and then it will be a lot easier to have a bowel movement. So all women should be doing this, not just women postpartum or during their pregnancy. This will help with preventing constipation or preventing straining, and this will definitely help with preventing any pelvic organs descending or any prolapse symptoms that you might experience. So this is probably one of my biggest tips. If I'm just looking at our take-home message, it's never too late or too early to start with the pelvic floor exercises. I'd recommend seeking help when you notice the start of any issues, whether it's with your bowel, your bladder, or sexual function. If you start any small issues, it's best to seek help immediately. I don't want women to normalize these symptoms. Lots of women tend to think or have heard from family members that when they laugh or if they sneeze, that it's normal to leak a bit. It's not normal. We want women to be dry. Focus on your health and your well-being. Eat well, drink enough water. Set little reminders or cues. This will just help you to remember these exercises. Remember the correct toileting posture. You can also tell your husbands, other men as well. It's not just for the women. And then especially talk to your other female friends or family members about these common issues, just so we can not normalize this and that they can seek help too.
Thank you for joining our webinar.